Today, we're going to talk about the Du Mai, or the governing vessel acupuncture points. Now, I like to keep it Du acupuncture points, not governing, because translation sometimes doesn't quite connotate what the meridian is all about. So I'm going to call it the Du vessel. We're going to look at all the 28 acupuncture points of the Du vessels, their function, location, and my clinical pearls since I've been practicing since 2003. In clinical practice, I use the Ren vessel much more than the Du vessel. However, it is very effective and very useful in practice. I do see a lot of women and I do treat a lot of fertility. So yes, I use the Ren vessel more. Now, if you haven't watched my Ren acupuncture point video, I'll have the link for you below. Welcome back to my channel. If it's your first time here, I'm Clara from AcuPro Academy, and I create Chinese medicine and acupuncture contents for students and practitioners, making it easy to grasp and fun to learn. Let's do this. Before we start looking at all the acupuncture points, by the way, I'm going to share a patient story using the Du acupuncture points you are going to love. And it's a little sad too, so be prepared. But before we do so, let's revise the characteristics of the Du vessel. The first one is the translation of the Du vessel is the governing. GV, governing vessel. I don't really like that, so I'm going to keep it the Du as I said earlier. The first function of the Du vessel, like all 8 extraordinary vessels, is to circulate essence. And it originates in the TCM kidneys like all the 8 extra vessels. This is why in clinical practice, those are so powerful and useful when it comes to tapping into kidney essence. Basically, our genetics, our aging system, and reproductive system. It's called the Sea of all young channels. It's very much the opposite of the Ren vessel, which is called the Sea of all yin channels. The area that the Du vessel influence are the spine, the brain, the neck, the entire back, and the eyes. It tonifies young and strengthens the kidneys, specifically when we use moxa in the lumbar area. We're going to talk about this today. It's also used for acute external febrile disease because it expels wind. But it also extinguishes internal wind. Extinguishes? Put out the fire. Extinguishes internal wind for seizures, dizziness, and tremors. It nourishes the spine for any issue in that area, and it nourishes the brain for poor memory. It also can support both the male and female reproductive system. And like the Ren vessel, it also helps calming the mind. Du 20 is a perfect example of that. Now, all extraordinary vessels have a confluent point that connects them to the 12 main meridian. The Ren vessel confluent point was long 7, while the Du confluent point is small intestine 3, which is one of the best points when there is back issue. Now, we often pair small intestine 3 with its opposite confluent point, which is also a Yang vessel, is bladder 62, which is part of the Yang Chao confluent point. Those two together are great to support the spine, the neck, the back, fantastic, but also really good to use when we need to balance the male reproductive system. I have an entire video on the 8 extra vessels, and I'll have the link for you below where I talk specifically in depth of those confluent points and how we can use them in clinical practice. And also, if you've missed the podcast with Dr. Yvonne Farrell, who came and gave a masterclass specifically talking about the 8 vessel and psycho-emotional pain, I'll put the link below for you too, because you have to listen to that podcast. She was amazing. She's my idol, so I'm going to promote her knowledge forever and ever, because everything that I've learned about the 8 vessel, I've learned it from Dr. Yvonne Farrell. One of the things I learned while taking her seminars was the psycho-emotional aspect of each of the vessels. When it comes to the Du channel, it is in charge of passion. Mingmen fire. Woo! It is the most yang, right? It is the sea of all yang meridians. So it's really passionate, excited kind of meridian. So when someone does not have any passion, is not passionate about anything, or has very low libido, that gives us clues to look into the Du vessel. It also controls our nervous system. Therefore, it is of vital importance for our capacity to think clearly. It is the force behind self-growth and self-development. I love that because I always like to learn and grow and improve. This is what life is all about, right? So having a strong back, a strong Du vessel allows us to have a better capacity for self-growth and self-development. And it is the vessel that gives us our independence and determination. Willpower, anybody? I'm pretty independent and I have a lot of determination. My husband would say that I'm stubborn because I don't give up easily, which can be really good because that means you don't give up easily, but it also can be very bad because you can't let go. It's all about balance, yin and yang, always. Let me share a quick personal story. I was born 10 weeks premature with scoliosis, asthma, and other issues. But talking about scoliosis, my spine wasn't straight. Thinking the Du vessel here, right? This is why I'm sharing this. When I was 8 years old, my medical doctor in France, we use a lot of different modalities, which is really, really good, decided that I needed to wear a brace. So I had a brace that looked like a corset, really. And I kept it for about 18 months. I had physiotherapy exercise every week. I had chiropractic adjustment every week. And I also did have acupuncture. Now, I don't remember what points did it because I didn't pay attention at the time. I was 8 years old. But I went for all those modalities every week for about 18 months. The hard part for me, they actually put a plywood board underneath the sheets in my bed, and I had to sleep on my back on the plywood board. And the first few weeks, I would cry because I just was uncomfortable. I didn't like to sleep on my back. I was a stomach sleeper, which is not great. Your head is to the side, and so it's not good for your neck or your spine, right? Now you could put me on the floor anywhere. I can fall asleep on my back, no problem. But it took a long time. Anyway, 18 months later, because I was growing with all those modalities and all this, change that I had to make, we took the brace off and my spine was straight. So when it comes to scoliosis, if it's addressed when we are children, it's much easier to rectify than as adults when we're already grown, right? I am so grateful and thankful for my medical doctor who really did such a fantastic job in helping me having a straight spine nowadays. So I wanted to share that story with you because I think it's fantastic what we can do if we address issues in a way that's non-invasive, so I didn't require surgery later on in life or was in constant pain like a lot of my patients who have scoliosis as adults still. So the pathway of the Du vessel, it's pretty simple. With the point themselves, it starts at the bottom of the coccyx and goes all along the spine, all the way up to the top of the head and finishes in the mouth. That is the main meridian pathway. However, it starts, as I said earlier, in the TCM essence area kidneys, so basically between the two kidneys in the Mingmen fire area. All 8 vessels start there, and they all connect to each other there. Okay, are you ready? Let's look now at the 28 acupuncture points of the Du vessel. Du 1 is located halfway between the tip of the coccyx and the anus. For some reason, a lot of practitioners are uncomfortable using that point. I have used that point many times. Of course, I tell the patients and I ask for consent where the point is going to be located. But it works really well locally when there are issues with the coccyx. I've had patients that went snowboarding and broke their coccyx. This is really good to help the pain in the area and heal faster, right? Du 1 is the lower connecting point from the Du vessel to the Ren vessel. I love Luo connecting point. And by the way, if you haven't seen my Luo connecting point video, I'll have the link below as well for you to watch because it's so useful to understand how we use them in clinical practice. So Do-1 regulates the Ren and the Do vessels for lower back issues, epilepsy, and manic disorders. But because of its location, it also regulates the lower jiao, specifically the intestines, for bloody stools, diarrhea, rectum prolapse, constipation, and hemorrhoids. One of the best combinations when it comes to hemorrhoids, of course, it's always good to do a TCM diagnosis first, but you can use Do-1 with bladder 57, RBI, which are 2 extra points on the forearm, large intestine 4 if there's a lot of pain, large intestine 11 if there is bleeding or burning pain. I would also add gallbladder 34 to relax the area and liver 3. Perfect combo for hemorrhoids. Do-2, I don't think I use that point a lot, is located in the sacral hiatus. It extinguishes, I have such a hard time saying that word. I want to say, put out the fire, extinguishes. I would have not been a good fireman. I can't even use that word. Anyway, it extinguishes wind, specifically internal wind for epilepsy and leg motor impairment. Now, we're going to talk about epilepsy with the Do vessel a lot. It doesn't mean that the Do vessel points are going to cure epilepsy, but they're really good to prevent attack and keep the body calm. That's what's important for epileptic patients because obviously more stress the patient experiences, more possibility of having epileptic attack. And the idea is to prevent because that's what TCM is really good at, is preventative health. Do-2 also warms the lower jiao for irregular menstruation, seminal emission, and impotence when it comes to male reproductive system. We don't have a lot of points that can help impotence or the male reproductive system compared to the women. When we look at impotence, we still have to make a diagnosis, but having a point like Do-2, also Do-4, kidney 10, that's a really good combination to help when it comes to erectile dysfunction. Now, all the points along the spines are going to go below the spinous process of each vertebra that they're associated to. So Do-3 is below the spinous process of L4. Locating points on the spinous processes is not that hard on thin people, but much harder on people that have more weight on. You have to practice palpation a lot, and the lumbar vertebrae are more flat compared to the thoracic vertebrae, so it's harder to palpate and you need a lot of practice for it. The lumbar acupuncture points of the Do vessels are going to be really useful if you want to use moxa because all of them kind of connect to the Ming fire. They're also really good at warming yang. So Do-3 warms yang, specifically kidney yang, again for irregular menstruation, impotence, and seminal emission. It also helps expel cold and damp in the channel, specifically for low back pain and lower leg motor impairment. We can use those points for multiple sclerosis, for example, when there is a lot of cold in the area and leg motor impairment. Do-4. Do-4 is actually called Meng Men, or the life gate or the gate of vitality, so it really connects to our Ming fire. It is located below the spinous process of L2. It is a fantastic point to moxa because it warms the body at the core. It strengthens the lower back for low back pain specifically that is worse with cold weather or on cold and feels really good with heat. So having moxa or heat lamp above this point when it's needled, it's fantastic. It warms kidney yang and nourishes essence. We don't have a lot of points that nourish essence. Ren 4 is another one, which is on the opposite side, right? So Do-4 nourishes essence and warm kidney yang. For low libido, impotent, seminal emission, and irregular menstruation. So this is really a male-female point that can be used for both genders, which I love because we don't always have those points. It also nourishes yuan qi, the source qi, for chronic illnesses. It's kind of like a preventative points, right? Like stomach 36 or Ren 4 for that matter. Those are great to use to support patients in preventative health. And it nourishes kidney qi for fatigue and early morning diarrhea. Early morning diarrhea in TCM is always a kidney qi deficiency. It happens just when you wake up in the morning and it doesn't happen the rest of the day. That is usually a kidney qi deficiency that's going towards kidney yang deficiency. If there is undigested food in the stool, now we have gone from kidney qi to kidney yang, which is always worse, right? Makes sense. So do 4 rocks. Do 5 I haven't used a lot, but it's located below the spinous process of L1. It strengthens the lower back, specifically locally for low back pain or stiffness, but it also helps in tonifying spleen and harmonizing the stomach for digestive system issue, such as diarrhea, abdominal pain, and indigestion. So you would think that the next point, do 6, would be at T12, but no, because, we all have to get confused when we have to memorize all points locations. So do 6 is located below the spinous process of T11. We skipped T12 completely in that meridian. Like the previous one, it strengthened lower back for stiffness and low back pain. It also tonified the spleen and harmonized the stomach, just like do 5, very similar function. But it can also be part of a protocol for epilepsy. Now, when we get to the best point for being part of a protocol for epilepsy, I will focus on that one because I think it's always good to take the best point for each of the function they are attributed to, right? Make sense? Okay. Do 7 is located below the spinous process of T10. It strengthens the lower back for pain and stiffness, but it also harmonizes the stomach, liver, and gallbladder when there is pain associated with fatty foods. And like do 6, it can be part of a protocol for epilepsy. Do 8 is located below the spinous process of T9. It is a really good point to strengthen the lower and mid back, and it eliminates internal wind. 4, spasm in the lower back, epilepsy, and tremors. Now, the tremors can be anywhere in the body, like Parkinson's, for example. This point would definitely be useful to add for a protocol when treating Parkinson's patients. And yes, it can be used for stomach pain, but we have better points for that. But really, do 8 is fantastic when it comes to epileptic attack. So I really want to emphasize that we would have to put do 8 as part of the protocol. You can add up other points for sure, but that's a really good point to make sure we put in there. Do 9 is located below the spinous process of T7. Like many of the do points, it strengthens the lower back for stiffness and pain. Because of this location, it also clears liver and gallbladder damp heat for jaundice and hepatitis. Now, it's not going to cure jaundice or hepatitis, but it's going to help manage the symptoms. It also opens the chest for asthma and cough. However, we have better points for that. So I would focus do 9 more on the liver, gallbladder, jaundice, hepatitis kind of thing than the chest, cough, and asthma for this point. Do 10 is located below the spinous process of T6 or the 6th thoracic vertebrae. It relaxes the spine when there's a lot of stiffness and neck pain. It clears blood heat and detoxifies. That is a really good point to combine with spleen 10, for example, which is not that easy because, of course, spleen 10 is in the front, do 10 is in the back, so it's not that easy to combine, but it's really good to detoxify. So when we need to detoxify and you're doing a back treatment, then do 10 would be a good option. And of course, it opens the chest for cough and asthma. Do 11 is located below the spinous process of T5. It relaxes the spine for stiff back or stiff neck. But what it's really good at, because of its location, it is at the level of bladder 15, which is the backshoe point of heart. So it calms the heart, mind, or the Shen for anxiety, poor memory, palpitation, and chest pain. So what's interesting is we can use dew points to reinforce the function of the backshoe point that they are located next to or at the same level. Now that's doubling our treatment in one specific organ or area that is affecting the patient. I love that. It also extinguishes internal wind for epilepsy and spasm, specifically spine spasm or the muscle around the spine. Do12 is located below the spinous process of T3. What's next to T3 spinous process, 1.5 student, lateral to it, is bladder 13. What's bladder 13? The back shoe point of the lung. This is where Do12 is going to be very similar. So Do12's function, apart from relaxing the spine and the neck, is to open the chest, to relax lung qi, bring lung qi down for cough and asthma. We talked about how the previous points can also open the chest, but this is the better one because, again, it's at T3, which is reinforcing the back shoe point of the lung. It also clears heat and detoxify, but it's not the best one for that, so I'm not going to worry too much about it. However, it clears heat from the yin level or the nutritive level. Remember, we have 4 levels in TCM. When there is a pathogen invasion from heat, it can enter at the Wei level, defensive level, the Qi level, the blood level, or the Yin level. And the Yin, Y-I-N-G, is the nutritive level. And it can create a lot of convulsions, specifically in children. So this is a really good point to try to mitigate this and bring the convulsions down, specifically for children. Do13 is located below the spinous process of T1. So it expels external pathogens like a lot of the points that are located around Do14 and that area. So it's great for sore throat, fever, occipital headache, acute stiff neck due to external pathogen invasion. It clears lung heat for dry cough, and it harmonizes Shaoyang syndrome for alternative chills and fever. Shaoyang syndrome main symptoms is alternating chills and fever in an acute external pathogen invasion way. Before we talk about Do14, did you know that all the graphics you're seeing today are from my book, AcuPoint Made Easy, which has sold all over the world. I also have a PDF version that you can download on any device with a lot of video links to complement it. The book itself ships all over the world, and it has all the acupuncture points function, location, and so much more, including my clinical pearls. If you haven't got your copy yet, the link is below for you. Now let's talk about Do14. That's a point we use a lot in clinical practice. I have used this point a lot in children as well because we can cup that point and children respond so well to this point. First of all, Do14 is located below the spinous process of C7. This is where all yang meridian converge or meet. All yang meridian pathway will go through C7 or Do14. So that makes it such a powerful point because that's a lot of energy there, right? There are 6 yang meridian that converge there plus the Do vessel on top of it. So it's like, woo, fire. Powerful area. It expels external pathogens, specifically cooling down fever, sore throat that is due to excess heat, and for acute stiff neck due to external pathogen invasion, of course. It clears lung heat for dry cough and asthma. Very good point for asthma for kids that have a lot of excess heat, specifically when we cup it. So good. And it calms the mind when there is excess heat affecting patients, resulting in epilepsy, seizures, and psychosis. Fantastic point to calm that yang energy. Before we finish with the points that are located more on the head area when it comes to the Do vessel, I said at the beginning I would share a patient story. So I wanted to illustrate this because we just talked about all the points along the spine. When I was in TCM college many moons ago, we had 2 patients. It was a very sad story, so I'm preparing you. It was 2 young men that were in the early 20s and were involved in a motor vehicle accident. Both of them ended up paraplegic, which is devastating, very sad. They were not able to move anything below the waist. So when they first came in, both of them, it had been about 2 months after the accident. What we did, or what the teacher and the supervisor told us to do, we did a full diagnosis, but every single time they came, and they came 2 to 3 times a week every week at the clinic. We did all the Hua Tuo Jia Ji point. So Hua Tuo Jia Ji are extraordinary points that are all along the spine, along the spinous process of the spine, just half as soon from spinous process. Then we did the dew points as well. Plus, we did a lot of leg points, bladder 40. Bladder 40 is the commando point of the lower back. Small intestine 3, which is the confluent point of the dew vessel, which is really affecting anything that is going to affect the entire back and neck. And then we also did electrostimulation. At one point, I can't remember how many weeks into it, one of them started to feel sensation in his leg. We had done bladder 60 and points around the ankle, and he felt that. That was so rewarding. We just couldn't believe it. We treated this patient specifically for the next few months, and he started coming back to the clinic, not in a wheelchair, but using a cane. And he did physiotherapy as well, just so you know. He did physiotherapy exercise every week. I think it was like 3 times a week. And eventually was able to walk normally again. It was so rewarding to see this. Very impactful while you're in school, right? However, I said there was 2 patients, right? And the other one did not regain his capacity to walk, which was very disappointing. Thinking about it, it gives me shivers because it was very sad to see that we had really great results with one, but not with the other. Now, the spine accident that affected the other was different. They were not the same. I wanted to share the story because, first, to illustrate that we can do so much with acupuncture. It is so fantastic. However, it is limiting, and we can give it a try, but we don't know what the results is going to be. So sometimes, we have to know our limitation, and sometimes not being able to help patients is very, very hard on us. So we have to self-care, give ourselves some grace, and continue to try to change the world one patient at a time. Now let's look at DEW 15, which is located below the spinous process of C1. So now we're really at the last vertebrae. It is right below the foramen, where the skull has obviously a big foramen where the spine enters to connect to the brain. So it is considered a dangerous point. DEW 16 and DEW 15 are both considered dangerous points. You can acupressure them, you can massage them if you don't feel comfortable needling them. Because of its location, it's really good to stimulate speech for stiff tongue, let's say after stroke, loss of voice, and speech impairment due to post-stroke. It, of course, relaxes the neck for occipital headache or pain or stiffness, and it calms the mind for manic depressive patient. However, we have a better point for that. We're going to talk about it. DEW 16, again, DEW 16 is a dangerous point, just like DEW 15. It is located half a tsun above the midpoint between the posterior hairline and the occipital protuberance. It drains fire and extinguishes wind, internal wind, for hemiplegia, after stroke, nosebleed, blurred vision, and dizziness. It can also expel wind cold that create headache and stiff neck, but that's not the best point, plus it's a dangerous point. We can use other points for that. But it is a ghost point. I love my ghost points. It's one of my favorite subjects that I teach in school when it comes to mental health. And if you haven't seen my ghost point video where I share all of them and how we can use them in clinical practice, the link is below for you as well. You can see where DEW 16 is located, right? It is a ghost point for people that have a hard time and are resisting change. They're basically inflexible when it comes to change. So it's kind of like looking at someone that's very stiff-necked. They turn that way, they don't move, they're very inflexible. While when it comes to ghost points, it's the people that are like, nope, I'm not changing anything. Very inflexible. That is a perfect point to help relax the patients and allow them to be open to change, because as we know, change is constant and we can't stop it. DEW 17, 18, and 19 are all very similar in function, so I'm kind of going to group them a little bit. DEW 17 is located 2.5 tsun above the posterior hairline on the upper border of the occipital protuberance. It extinguishes internal wind for epilepsy. Here's another one for epilepsy, which we can combine with DEW 8. It also helps with eye pain and dizziness because that's all internal wind, right? Anything that's moving and shaking. It relaxes the neck, of course, because of where it's located for occipital headache or stiff neck. And it calms the mind for manic depressive patients. Do 18 is located 4 tsuen above the posterior hairline, and it does exactly the same thing as Do 17. Do 19 is 5 tsuen above the posterior hairline. Remember that from the anterior hairline to the posterior hairline is 12 tsuen. So it's 5 tsuen up, not quite halfway, a little bit below that. It's not easy to locate, I totally get that. And it does the same thing as Do 17 and 18. And now we have arrived at the highest point of the body, Do 20. Do 20 is 5 tsuen from the anterior hairline. So remember, this is 12. So this one is closer to the anterior hairline. And the way we locate it is we go from the tip of the ear when we fold the ear. So if I fold my ear, the tip is here. We go directly above, and then we have 5 tsuen. And that's where Do 20 is. It is the highest point in the body, opposite of kidney 1, which is the lowest point in the body. Kidney 1 is the most grounding point. Do 20 and kidney 1 together is a fantastic combination. First of all, let's look at Do 20's function. First is to lift energy. So when we are tired, I always say you kind of have like a little puppet. You got a string, boom, Do 20, right? So it lifts our energy when we are exhausted and really fatigued. It raises qi. So we can use it as part of a protocol for prolapse or very, very exhausted patients. And usually when people are exhausted or have prolapse, we would use Do 20 in combination with Ren 6, the C of qi point, and spleen 6. Those 3 points are enough to lift all that energy. Now you can add up stomach 36, of course, that would work really well as well. When it comes to Do 20, it also does the opposite. It calms the mind, bring the energy that's up in the head down for insomnia, irritability, manic behavior, anger, and it extinguishes liver wind and brings liver yang down. That's that irritability or anger, but also for high blood pressure and dizziness due to liver yang rising. One of the things that we do when we needle Do 20, if we need to calm the mind, we're going to needle towards the back of the head because we're going to needle against the meridian, right? The meridian flow is to come up. So we're going to needle towards the back of the head in an oblique way. That is calming the mind, bringing the energy back down. If we want to lift the energy for fatigue, prolapse, and just exhaustion, we are going to go with the meridian because the meridian goes forward this way. That's the flow, right? So we are going to needle with the meridian when we want to lift that energy. That makes a huge difference in tapping in the function of Do 20, which I love to use in clinical practice. I talked about the combination of the highest point and the lowest point, which is kidney 1 and Do 20 together. How do we pair them and why would we want to pair them? Now, if you do tuning forks, or if you've learned tuning forks, which is vibration therapy, this is a very good combo to do. Now, kidney 1 is the most grounding point. It helps to calm the mind. It helps with insomnia. And Do 20 also helps calming the mind for insomnia. What happens when patients say, I'm exhausted. I'm exhausted during the day. I can't wait to go to bed. I go to bed and I can't fall asleep. Even though I'm so tired, I can't fall asleep. So what do? We needle Do 20 to bring the energy up, and we do kidney 1 or moxa, we don't have to needle, and we bring the brain or the mental energy down. So mental energy down with kidney 1 and physical energy up with Do 20. Perfect combination. Do 21 and Do 22. Together, same function. So Do 21 is 3.5 tsuen above the anterior hairline, and Do 22 is 2 tsuen above the anterior hairline. I usually needle them transverse backwards. They both extinguish liver wind for epilepsy, convulsion, and dizziness, and they both open the nose when there is stuffy nose. However, there's a better point for that. Do 23. It's only 1 tsuen above the anterior hairline. Again, I needle this one backwards probably 0.3 to 0.4 at soon. So it's very shallow, right? One of the best points to use to add to your protocol when there's stuffy nose. So large intestine 20, yin tongue, do 23 together for stuffy nose, perfect to open the nose and add up large intestine 4. Now, if the person is pregnant, I can't do large intestine 4, but I sure can do yin tongue, large intestine 20, and do 23. We can also add up for sinuses issue like stomach 3 or small intestine 18. That helps as well. And gallbladder 14 if it's the upper sinuses issue. Fantastic. It also expels wind heat for frontal headaches and nosebleeds. There's another power do 23 has, which is it's another ghost points. Oh, here we go again. This is a point that is used for long-standing invisible phlegm affecting the mind. This is something we use for dementia people, catatonic people, and Alzheimer's patients. Now, is it going to stop it? No. But it can manage and mitigate the rate at which the disease progresses. I have never used do 23 as a ghost point. I have to be honest, I don't see a lot of patients with dementia or Alzheimer's, so I haven't had the occasion to use this. I use it a lot more for opening the nose. Let me know in the comments if you treat patients that have dementia or Alzheimer's, because it's not easy. Obviously, they have to agree to come and they have to be brought often by a family member, so it's not always easy. So be interesting to see if you do treat patients that have dementia or Alzheimer's, right? Do 24 is located half a tsun above the anterior hairline. It extinguishes liver wind, internal wind, and brings liver yang down for dizziness, seizures, and vertigo. So really much more for the dizziness, vertigo kind of thing. And that's why I use it a lot. I love to use this point when there is dizziness or vertigo. Now, remember, when there is vertigo in TCM, there's always excess phlegm. No phlegm, no vertigo, right? So we also have to do stomach 40, the best point for phlegm when there is vertigo. It's not an easy disorder to treat, but acupuncture has great result with it. So do a TCM diagnosis, make sure you include stomach 40 and do 24. It's also really good in calming the mind for anxiety and insomnia. Specifically, you could add up Heart 7 with do 24 and Pericardium 6 and Ren 17, to really round up really well the best points when it comes to insomnia and anxiety. It also opens the nose for stuffy nose, but we don't have to worry about it because do 23 is the better point for that. Have you ever needled do 25? It is at the tip of the nose. That would be very sensitive. So I have to be honest, I've never needled that point on anybody, but I've massaged it or showed patients how they can massage it, right? Because at least we could do acupressure. We can needle it. I just never done it. Now, this is a point we use often in emergency situation. If there is fainting, loss of consciousness, this is a really good point to use with do 26 to try to revive the patient. It helps open the nose for long-standing nasal congestion. Again, I think large intestine 20 would be way less painful than do 25, right? You agree with me? Yeah. But one of the things it does is it lowers the desire to want to drink alcohol for addicted patients. I don't know if you've ever noticed, but people that drink a lot, usually the blood vessels on their nose are very, very expanded and their nose is very red, right? So this is a really good point to lower the desire to drink. So if you have people that come for addiction, for example, of drinking, you can do the NADA protocol in the ear, which is sympathetic point, Shenmen, and then lung, liver, and kidney point in the ear, as well as doing do 25 if the patient is okay with it. We got more ghost points coming your way. Do 26. Do 26 is located at the upper third of the junction between the upper lip and the lower nasal passages. It is a point that I have acupressured before, and it's great for acupressure. You can also needle it, of course. I have needled that point. This is, again, just like do 25, a great point to revive loss of consciousness. Actually, a few years ago, I saw a video online where someone lost consciousness in the subway and another person came and did do 26 to revive them, and it worked really well. So that was really cool for our profession and for this person that lost consciousness in the subway. It's really good to use as well post-stroke or for Bell's palsy, for paralysis basically of the face. It's a very good point for that as well. And I've used it and needled it for that purpose. It's the last ghost point of the Du vessel. Yes, another one. Can you believe it? The Du vessel has a lot of ghost points. It's very special, very strong, very powerful when it comes to the mind, right? We said at the beginning that the Du vessel is really good in calming the mind. Du 26 as a ghost point is used when there is uncontrollable laughter, intergenerational trauma, and hysteria. Specifically, when there is trauma, emotional trauma, intergenerational, or hysteria that result into this laughter that's almost manic laughter when there's nothing funny, it's not funny, but the person is laughing and laughing and there's nothing funny. When I learned the 8 extra vessels from Dr. Yvonne Farrell, she really shared a lot about intergenerational trauma and how the 8 vessels can help release it. And actually, if you listen to the podcast, you'll see she made me cry because she talked about intergenerational trauma affecting my mother and what happened in the end before she died. I absolutely love that episode. Again, the link is below. So this point is really good for that. And this is why I think acupuncture rocks. Come on, this is fantastic, right? Okay, we got 2 more points. And I have to be honest, the last 2 points, I have never needled. Ever. And I've never had them needled on me. Let me know if you've needled them before. Du 27 is located on the upper border of the upper lip. And that is a very sensitive area. Okay, I, like most women, have a mustache growing. So there's waxing, right? I have to tell you, that is such a sensitive area. It's just like, wow, it makes me cry every time. Like I get tears coming out, right? So I think that Du 27 would be quite powerful and sensitive to needle. So its function is to clear heat for swelling or swollen gums, convulsions, and again, facial paralysis like Bell's palsy or post-stroke. And it calms the mind for manic depressive patients. Last point, Du 28 is in the mouth, located between the upper gum and the frenulum of the upper lip. So Du 28 can clear heat like Du 27, specifically for facial paralysis like Bell's palsy and post-stroke, and it can calm the mind for manic depressive patients. We have better points for manic depressive patients. We have better points for convulsion. And then when it comes to Bell's palsy or stroke, there's a lot of points on the face that we can use, including Du 26 or Du 25 and all the points, the REN 24 and other points around the area that is affected. So I haven't used those 2 points, but let me know if you have in the comments below. Wow, we have done all the 28 acupuncture points of the Du vessels. They are very useful in clinical practice. I have to say, for me, I love Du 1 specifically because of hemorrhoids or rectum prolapse, for example. Du 4 because it really restores and warms the yang and essence. It's such a great point for preventative health. Love that point. Du 8 as part of a protocol for epilepsy. Of course, we can look at more points. Du 14, the big yang conversion, meeting yang of all meridians. So very powerful in clearing heat, specifically external pathogen heat and acute. And then we can look at all the points on the head, but obviously Du 20 is the rock star. It just rocks because it can lift energy and calm the mind. I hope that was useful. I invite you to click here to access my playlist of all the meridians, points, functions, and locations for your benefit. In the meantime, have a fantastic day. Keep rocking it using TCM because after all, acupuncture rocks.